Hello again. We're going to start talking about the pectoral or pectoral girdle now. That's kind of a funny name. The pectoral girdle, again, refers to, we're moving into the appendicular skeleton, so your appendages. And in the introductory video, we talked about how you have a pectoral or pectoral girdle, so you have bones that surround the superior portion of the trunk. And then you have your pelvic girdle, which consists of your two pelvic bones that form this bowl that is surrounding the inferior portion of the trunk. And then you have, of course, you've got your arm appendages attached to the pectoral girdle, and you've got your leg appendages attached to the pelvic girdle. Girdle just means to surround. All right, so let's take a look at the pectoral girdle up here. All right. All right, so the bones that form comprise the pectoral girdle or pectoral are your clavicles. You got a right and a left, and then your scapulae. You got a left and a right of those. You know those as your shoulder blades. Okay, and those are pretty straightforward. And you can see that your clavicles are contacting, forming articulations with the manubrium of the sternum, right in there. And then over here, they articulate with, this is actually part of the scapula on each side here. So they extend from the scapula on each side, have a little bit of kind of an S shape, and connect over to the manubrium of the sternum. And actually that's it for the clavicles. There are no other features you need to know for those, so I'm actually going to deselect those guys. And let's rotate around and take a look at your two scapulae with an E on the end would be the plural form. And let me kind of zoom in just on one, because the most of your interesting features for the scapulae are over here on the posterior side. All right, let me deselect these so they're not blue. All right, taking a look at the right scapula here. First feature on your list, the medial margin. Margin means edge. So guess where your medial margin would be. This is the medial margin, right in here. Because that's the edge over on the medial side, and then the lateral margin will be over here. That makes sense, because it's the edge of the scapula over on the lateral side of the body. The spine on the dorsal process, this is where your shoulder blade sticks out. That's the spine on the dorsal surface of each of your scapulae. And if you rotate it around, you can see it sticks out pretty far on each side. And why, again, when we mentioned on an earlier video clip, why do you have these processes, these projections on your bones that stick out so far? Those are almost always going to be places where muscles and tendons or tendons of muscles are attached and pulling on the bone at those locations, and wherever things are attached to bone and pull on them, it stimulates growth to provide more support and a larger surface area there for attachment. Okay, acromion process. This is an important feature of the scapula. Let me highlight the scapula again in blue, and kind of looking down on the top here. Where you see this feature sticking out to the side, that is called the acromion process. Okay? The widest portion of your shoulder blade on each side is the acromion process sticking out over there. The coracoid process, get on my pen mode there. My pen. Rotate around this way. So we're kind of looking, we're looking down from a superior position. Let me rotate this around. And let's see what's going to be our best view here. Let me deselect this for a minute. I'm going to say goodbye to that ligament. And I'm actually going to get rid of the clavicle for a second, so you can see this a little bit better. There we go. we get rid of some of these ligaments, you can actually see the bone itself a little bit better. Okay, so right in here on the anterior side, you've got another little projection, not little, it's a pretty big projection on the scapula. That's called the coracoid process. Kind of looks like a hook. If we look down on top, got a little bit of a hook shape to it. That is called the coracoid process. And it sits down a little bit inferior to your acromion process up in here. There's your acromion process. And you can see both of those are very close to, this is the ball of the humerus. The humerus is your upper arm bone. So right in here, this is where you're forming your shoulder joint between the humerus and the scapula, your shoulder blade bone. Kind of rotate that around. Yeah, now you're getting a much better view of the scapula. Looking down on it from top, back here on the posterior side, that's the acromion process that I'm tracing with the cursor there. And this little hook-like feature right there is the coracoid process. All right, and then the glenoid fossa. Let me kind of zoom in here. All right, you can see this is the ball of the humerus right in there. And you can see that it's making a contact, or coming close to making a contact with a little depression right in there. And this is the lateral side of the scapula that you're taking a look at. Let me make the humerus go away. And if we zoom in, so that little depression right there is called the glenoid fossa. So a fossa in a bone is a depression. And now this is surrounded by, you've got ligaments and tendons that are connective tissues that make up a broader cavity called the glenoid cavity. And this glenoid fossa in the scapula on each side is, makes up part of that. But the cavity itself consists of additional dense regular connective tissues that help form the shoulder joint. The shoulder joint is a ball and socket type joint. You may have, of course, noticed that the head of the humerus has kind of a ball shape, and that's what allows you to rotate your arm in many different directions. That's called a ball and socket type joint. Your hip joint is also a ball and socket type joint. We'll talk about those more later when we get into the chapter on joints. There's another view of the scapula, and we can zoom over here over to the left side as well, just so you've had some different views. Kind of rotate it around. And this one's still got the many ligaments. What's kind of nice about visible body, you can highlight the names of those ligaments and it will name all of those for you. But everything I've got in blue there, those are dense regular connective tissue ligaments that help hold the humerus over here to the scapula. Those two bones form your shoulder joint. And the clavicle is also right in there with them as well, forming articulations. The clavicle articulates with the scapula. Okay, and if you take, let me see, let me deselect everything. Let me highlight that scapula, and let's hide everything else because I want to show you a disarticulated scapula. If I rotate it around this way, if you were just looking at a scapula in the laboratory by itself or just looking at pictures of the scapula by itself, this is the anterior side, which articulates with the ribs. So this is the side that's facing the ribs, and it is a lot smoother. So keep that in mind as well. If you're looking at this side where you've got the big spinous process sticking out there, that is the back side or posterior side of the scapula. All right, so those were the bones of the pectoral girdle, and now we're ready in the next video clip. We're going to move on to your arm bones and take a look at those.